What does functional quadriplegia mean? Functional quadriplegia. What does functional quadriplegia mean? Functional quadriplegia. If you're wondering, what does functional quadriplegia mean? It's important to know the causes of this condition, and the possible treatments for this condition. This disorder affects patients suffering from severe brain or spinal cord damage, and is often caused by trauma or infection. It can also result from a weakened blood vessel. To find out whether you're suffering from functional quadriplegia, contact your healthcare provider and discuss the symptoms you're experiencing. Some causes of functional quadriplegia are as severe as spinal cord injury. These injuries can disrupt the functioning of nerves and muscles in the spinal cord. One of the most common causes is traumatic injury. A fall, an auto accident, or an auto accident can cause a spinal cord injury, compromising the ability to move limbs and communicate with the brain. Traumatic injuries to the spine and surrounding structures can cause the spinal column to degenerate and lead to functional quadriplegia. A fall from a ladder is another cause of functional quadriplegia. If you're on a ladder, you're more prone to the condition. According to the NCISC's latest report, SCIs are more common in men than women. In fact, the NCISC estimates that there were 27,453 cases of SCIs among men in the U.S. in 2019 compared to 6,672 cases of SCIs in women. The diagnosis of functional quadriplegia is important. The correct diagnosis can determine the extent of a patient's disability and the length of their stay in the hospital. Proper documentation is essential for proper treatment, and can help predict the risks of readmission in the outpatient setting. In addition to the medical and surgical treatments, a patient will need psychotherapy and occupational therapy to help cope with the social effects of quadriplegia. If you have been diagnosed with functional quadriplegia, you may be concerned about your diagnosis. It is important to recognize that it could mean a condition called spastic or complete. While functional quadriplegia isn't always a result of a stroke, it can be a sign of a spinal cord disorder that causes a person to lose movement. It is often accompanied by other symptoms, such as numbness or a deteriorating limb. While there are many medical conditions that can cause quadriplegia, the condition is most common in elderly patients and can occur due to trauma, infection, or trauma. It can also be the result of an illness that causes the body to stop working properly, such as a brain tumor. If you're looking for a treatment for functional quadriplegia, your doctor will likely prescribe you medication to treat the symptoms of the disorder. In addition to the physical symptoms of the disorder, functional quadriplegia can impact a person's bladder and bowel function. People with quadriplegia have various degrees of loss of bladder control and can experience constipation or urinary tract infections. If left untreated, these conditions can lead to serious complications. Your healthcare team will work with you to help your patient regain bladder and bowel control. Although functional quadriplegia is common in older adults, it can also be a symptom of another medical condition. People with this disorder may have difficulty with bowel and bladder control. They may also experience numbness in their hands and face. Sexual dysfunction can be a symptom of functional quadriplegia. There are no known treatments for functional quadriplegia, and there is no definitive cure for it. If you're diagnosed with this disorder, your doctor will assess your condition and make a proper diagnosis. Symptoms of functional quadriplegia are often attributed to various medical conditions. It is often caused by a stroke, but other causes can also cause the condition. Certain kinds of cancers may also cause the symptoms of functional quadriplegia. They may develop a variety of conditions, and it is important to seek medical advice. Depending on the type of disease, you might be experiencing a progressive condition that affects your mobility. The prognosis of functional quadriplegia depends on the underlying condition. A quadriplegic's condition can be caused by stroke or spinal cord injury. Luckily, with the right treatment, most quadriplegics live active lives with little or no permanent impairment. But if their paralysis is caused by an injury, it may not be possible to walk or move. It's important to be supported by family and friends. If you're unable to walk or move due to your injury, a support group can provide much-needed guidance. Functional quadriplegia, quadriplegics.